Hospital emergency room crisis. Emergency rooms often get overcrowded due to a backlog of patients awaiting beds elsewhere in the hospital. At the hospitals we visited, we saw patients placed on uncomfortable stretchers or gurneys in hallways, and other high-traffic areas that were never designed for patient care. These waits can last as long as 28 hours for a minority of patients. Overcrowded emergency rooms also make it difficult to control infections. The first Canadian to die in the 2003 SARS outbreak, for example, was infected after spending one night in a hospital emergency room. Ontario's 57 large community hospitals, which account for almost half of the province's 31,000 publicly funded hospital beds, recorded 4.3 million visits to emergency rooms and performed 1.07 million surgical procedures in 2016. At the three hospitals we visited, 1 in 4 patients with critical or life-threatening conditions had to wait an average of 4 hours for surgeries that should have started within 2. Half of patients who should have undergone emergency surgery within 2 to 8 hours waited an average of 10 or more hours longer. There were 4,110 alternate level of care patients occupying hospital beds, even though they no longer needed them. About half are waiting for long-term care home beds because there are not enough available in the community. We calculated that hospitals could have treated about 37,550 more patients if these alternate level of care patients were not waiting in the hospital. Hospital beds are also more expensive than long-term care beds. So to be clear, the $61.2 billion OHIP and long-term care is nothing but government-run health insurance with a not-for-profit, expensive and inefficient community-based delivery system.